Some common conditions and postures that we see, movement dysfunctions that people come in with, is mobility dysfunction of their mid-back, their thoracic spine. A couple of things that we like to do here to help treat that, things that you can do at home, is get on the floor, grab a foam roller. If you don't have a foam roller, buy one on Amazon, $9.99. One way to help create some mobility in the mid-back is foam rolling. Here, Jeff is on this foam roller. We're gonna help just kind of massage the area. We're gonna start from the bottom down in here and roll our way up. So go ahead and just massage it a little bit, loosening up the tissues. You can go, yep, right there and come back down, perfect. And when you're doing this, you can actually start to feel certain areas that are tighter than the other, right? That are more tighter than others. Is it more of the lower half, the mid-back?
More mid-back.
More mid-back right there, good. You could even hold it there for a little bit, good. Kind of massage up and down, those tight and tender areas, good. After loosening up the tissues, you're gonna come back to neutral. Good, and now we're gonna start to get more of an extension. Let's have you lift up a little bit. We're gonna put this more on the lower part of your low back, which is right here. Right there. So this is the lower part of that T-spine, hands above the head, just like this. And we're gonna work on extension. So the thoracic spine, one of the jobs for the thoracic spine is extension and also rotation. So right now we're gonna work more on extension. So you're gonna bend back on that foam roller, keeping the hips down. Keep the hips down, good. And you're gonna bend backwards, just where it's fulcruming right from that foam roller. Good, and breathe. Breathing in the rib cage feels pretty tight, right?
Yeah.
Good, good. After you feel that's kind of loosened up, you're gonna work your way up. You're gonna roll it upwards. Good, right there. Hip down and extend backwards. Good, relaxing everything, breathing. With each breath, you wanna think about you going further and further, getting more extension on that mid-back. Now I wanna get a little bit higher towards that T1, T3 area, right there, good. It's gonna be a little harder for you to extend back just because the way those joints are aligned or oriented, but we're still gonna get some extension there, good. Breathing, allowing your breath to help you relax a little bit. How does that feel? After we loosened up the tissues, we want some extension in this mid-back. And one way we can achieve that is using a foam roller to get more extension. You're gonna have your arms up just like this. On the foam roller, you're gonna allow that to glide your body. Think about a string pulling you from the sternum. Let this sink downwards. Good, let it go a little bit more. Keep that butt down. Good, let it extend right here. Good, and breathe, hold. When you find that really tight area in that mid-back, holding it and taking 5 deep breaths to help relax it. That's elongating the thoracic spine with extension, helping decompress those joints. This could be caused from all the sitting for long hours or flexion of certain jobs that we do at our work. How's that feel, Jeff?
Real good.
Good. After we worked on loosening up the tissues and getting some extension, now we want to work on the rotation component of the thoracic spine. We're going to have Jeff put his left hand on his head. These are called thread the needles. We're going to do more of a short lever with his arm, with his hand on his head. You're going to spiral downwards. Good, keeping that butt slightly down. Make sure you're not using the hips. It's all coming from this mid-back. You're going to rotate upwards, elbow up towards the sky, looking up, following that elbow. Good, breathing, good. Back down. So you can see Jeff is pretty tight in this mid-back, so we're gonna work on this. I'm gonna add an assisted passive stretch as the further he goes. Keep blowing out. Stretch a little bit more, good. And then back down, good. You could try this at home or have someone help you, kind of like what I'm doing here, to get a further stretch. That rib cage and that T-spine loves rotation and extension. Make sure you take breaks when you're working. If you are sitting at a desk, and do something like this to get some better mobility and improve your posture. Really good for pain between that shoulder blades. Good, and relax. If you feel you have similar conditions, go ahead and give us a call here at Optimized State Spine Movement and Wellness Center. We'll see if we're a perfect fit. Once again, I'm Dr. Gerald, and I hope to see you soon.